We'll move into our 8:35 item, COVID-19 update. We have with us again this morning, Public Health Director Kathy McKay and Nursing Director Jamie Hennon. Good morning.
Mayor and Commissioners.
Oh, Becky, sorry.
Hmm?
No, Becky, sorry.
Oh, I noticed that.
Yeah, she had a conflict for today. There we go.
It's just nice when she can be here to, in case
Yes.
there's questions regarding
Yes.
Absolutely.
epidemiologist opinion.
That's right. Okay, I'll start it off with our active cases, and as you can see, they're still a trend upward in Clay County. We're at 562 now from last week of 505, and then across the state of Minnesota, the 25,387 to now 33,308. So we're not seeing the trending down yet. Cass County also did see an increase in their active cases at 740 this week, and active cases across the state in North Dakota are not trending down much, but a little bit decreased on November 15th, 3006. And then we look at our Clay County active cases by age, and you can see the distribution of the active cases, still high numbers in the 5 to 9 year group. That's the highest we're seeing now, and also elevated numbers in the 40 to 44 age group at this point. And cases, the cumulative cases by age, and so our total cases are 11,449 for our entire pandemic. So, and you're seeing this is cumulative, so the 20 to 24 cumulatively are the highest group. And these are the Clay County cases per week. So from July of this year to current. So we're seeing the upward trend that started around in August. And then you can see the shaded gray last line is preliminary, of course. There's 281 cases so far that were reported. So the 388 has been the highest number for this fourth wave that we reported the end of October. And this is the overview of the cases per week starting at March of 2020. So we've seen the spike again over the past couple weeks. And this is highest since we've seen the spike in November of 2020. So the gray shaded bar at the end, of course, is a preliminary number. When the data catches up, we'll see a different number on that end. So there's no indication that we've reached a peak yet. It's this wave, as we talked about before, this fourth wave seems to be much longer than typical waves have been, so we're still not seeing the decline of cases that we normally would see.
Kathy, can I ask you a question?
Sure.
How long does somebody stay on the active case list? So in other words, if you can test positive for quite some time after you actually get the virus, but how long do they stay? How long do they stay on our active list?
Well, they're considered an active case until they complete their isolation process. So the active case and the isolation is 10 days. So once they complete that 10-day process, then they're not considered active anymore.
So when we look at this and we see November 15th, 562, and November 8th, there was 505, is the difference the new cases? Or is it not necessarily the new cases?
Are you looking at the?
I'm looking at your very front page.
Oh, the front page. Oh,
Very front
okay.
page.
So yeah, the number of active cases, yeah, within a
That
week.
day.
Right. There would still be, I mean, some of those cases would still be on the active list, but those would be new cases. So she's looking at the numbers of November 8th. That's the number we have registered in the data. And sometimes it's slow to catch up, so it's as accurate as you get from the day she's looking at it. But she's also looking at it November 15th. There's 562 cases. So your question is, how many of those 505, if I'm understanding that correct?
Well,
Part of that
no, I
562?
guess another way to look at this is how many new active cases do we see on a weekly basis versus, because somebody can stay active. I think you could probably stay active for, what, 2 weeks maybe? I mean, a quarantine period can be 14 days.
Quarantine is if they've just been exposed, but isolation is 10 days?
Isolation is?
Yep.
Okay,
if
so they
you
can be
have
on for 10 days then?
Correct, yeah.
So that's considered the infectious time, but we do actually say if you still have a fever, stay home. But it is that 10-day window that they're going into the data basically for that 10 days.
Okay, so the active cases is based on, they're going to, once they hit that, they're there for 10 days?
Right, yes.
Okay.
Okay, and then we're looking at this, this is the CDC level of community transmission. So we showed this the last couple of weeks. There's just one county that's in the substantial level. Otherwise, all of Minnesota is in that high transmission rate still. And these are cases from November 7th through the 13th. So this is showing that trend of cases. And then the total number of deaths, we're at 100. That changed last week as well. So no new reported deaths, and that's throughout the pandemic. And this is Clay County Hospital admissions per week. So it's the number of COVID hospital admissions per week for Clay County residents. So that's what this is showing. So the week of 10/31, there were 14 new admissions to the hospital and 8 reported so far for last week. So those were new admissions. And we haven't seen that number, as you can see from the graph too, since November 2020. So the number of hospitalizations have been higher than, the 17th, I think, of, if I'm reading that right, 29th of November, we had 17, but then the numbers dropped down for quite a while. Now we're back up to 14.
Is an admission somebody who is overnight, at least one night over?
Correct, yes, that's correct. Those don't count any emergency department, visits. Those would be if they've been admitted into the hospital. You are correct. And the Clay County Hospital admissions by age groups, you see the 42% are the 65 plus, and the 0 to 64, 58% of those admissions. So it breaks down the admissions by age, residents by age. So again, the majority is the 0 to 64, the majority of the percent of admissions. So total of 103 cases admitted to the hospital as of August 1st. And then I'll let Jamie continue.
Okay, so the hospital capacity in the Fargo area, Essentia in Fargo had 2 staffed ICU beds and for adults, and then 0 pediatric ICU beds. And then Sanford had 4 adult ICU beds and 1 pediatric ICU bed. And then statewide, the total ICU beds for adults is 15, and only 1 ICU bed for a pediatric, and that one is in Fargo as well. And I know we've talked a lot about hospital, capacity, and one of the things that we've discussed is the fact that there is a very wide area that transports clients to the Fargo area, so that impacts our hospitals in the Fargo area as well. I live, an hour north of here, and our little hospital transports to the Fargo area on the Minnesota side, so it's a pretty wide service area for them. And then looking at the next slide, the North Dakota hospital data. This slide shows the statewide hospital data for North Dakota There are currently 163 hospitalized due to COVID and 16 in the ICU. Compared to last week, there were 148 in the ICU, in the hospital, and 16 in the ICU. And then the middle chart shows the current hospitalizations broken down by age group. Currently, there are 4 pediatric admissions, and the chart on the right shows the age group by total admissions through the pandemic, so that's cumulative as well. And then the next slide is the Sanford, so the 22 Sanford Health-owned hospitals. And again, the point of this slide is just to really show that it is primarily the unvaccinated that are in the hospital, in the ICU, and on ventilators. And so you'll see the numbers there for each of them, but the majority of the hospitalized cases continue to be for the unvaccinated. And then this slide shows the breakthrough cases that are those that are fully vaccinated for the last 14 days or more, and then develop and test positive for COVID. Breakthrough cases in Minnesota, 2.245%, breakthrough hospitalizations, 0.098%, and breakthrough deaths, 0.016%. The takeaway for this is over 3 million Minnesotans are fully vaccinated and will continue to see strong protection from severe illness and death. And then we have the statewide vaccine data for ages 5 and up through November 11th of this year. And so the people with at least 1 dose of vaccine, we are at basically 3.5 million Minnesotans have had at least 1 dose, so 67.7% of those that are eligible in that 5 and up. And then those who've completed the series, we are at 63.3%. And again, that's for those that are 5 and up that are eligible. And then you'll see the breakdown there. There has been a pretty good response to that 5 through 11 age group. Those that were ready were looking for a place to get a vaccine very quickly and were vaccinating their children. We have a clinic ourselves this week, but the response for those appointments is not very high. So I think they got out and got them when they can. But these are basically those that are continuing to be vaccinated in this age group in that breakdown. And go to the next one.
Jamie, didn't we used to see how Clay County compares to the state?
We did, and we stopped doing that because we felt like the data was just not real accurate because of the North Dakota and how things are coming. Still, people are telling us, I got my vaccine, I think.
Yeah, so when some
as
people
well.
might say, well, Clay County isn't doing as well as the rest of the state, there's the data that we have
Well, the
can be
data,
misleading, right? Because
right. The Minnesota COVID site, if you go to that, you can manipulate that. You can choose the state, the county, you can change the age group, you can do a lot with the data on there. And it does show Clay County as that we were lagging, but that's why it's not accurate. We keep bringing, we were bringing in it's really not true because we know that people are being vaccinated on the North Dakota side and it's not getting over. So.
Thank you.
So yeah, so then we'll look at the Clay County doses administered by Public Health, 16,812. We had 2 clinics last week. Both of them were over the lunch hour and then till 6 o'clock at night, just to cover, make it as possible for people to get in. We did have less of a response than we did the last week, so 273 people were vaccinated on those 2 days from 11:30 through 6. And so we already saw a reduction. Again, I just want to point out that there are so many opportunities for vaccine in the community, and I think that's really what it's about. It's not about access because we are being as accessible as we can. We serve those that are coming in and saying they would like a vaccine, but we're doing what we can basically to serve them. So this week, what we're planning is we did receive our Pfizer vaccine for the children 5 through the age of 11. So we have a clinic tomorrow. That clinic is from 3 o'clock to 6 o'clock, thinking we can get kids after school and into the evening. We didn't have a lot of people signed up yesterday, so again, we're pushing it out to the media like we have been, and the schools.
And where the location for that is?
The Family Service Center in the ITV room. And then on Thursday, we're having a clinic from 11:30 to 5:30, and that will be for anyone 18 and over that would like a booster. So we'll have Moderna, J&J, and we're also offering first and second doses for anyone who's eligible for that as well. So yeah, I guess that's, we continue to use our COVID vaccinators as much as we are able, and providing as many opportunities as we can.
With the increased number of cases, how is your staff holding up in terms of the?
The case investigation?
Yes, that's what I was.
They are very busy. We do have quite a few people that we brought on within like the last couple months. And so they're busy, very busy. And Becky leads that team, so she's very busy as well. But it's important. We get a lot of phone calls. If they're tested on the North Dakota, they still call to find out what the guidelines are on the Minnesota call. So if we don't call them, they call us. So it's important.
Anything else, Jamie? Kathy, anything else? Okay, any questions for either?
That's it.
Thank you.
Thank you.
See you next week.
Okay, we'll be back.
That was your hint.